Okay, so we have gone live. Good evening, everybody. We are very pleased to conduct our final webinar of this series on parenting and climate change. So for our final webinar, the topic is on pediatric health and planetary health, and we're exploring the connection between the two. And we are super, super, super honored to have Dr. Amanda Zain, who is the Deputy Director at the Center for Sustainable Medicine and Assistant Dean of Sustainability at NUS Medicine. She has a stellar bio, but what I would really like to highlight is that as a pediatric consultant and a mother of two, her call to action started when she learned that 88% of the burden of climate change falls on children. And since then, she has been inspired to actively engage in clinical sustainability projects in order to advance the community of practice in sustainable healthcare amongst clinicians in Singapore, because we also know that the healthcare sector is one of the largest emitters of carbon emissions. So it's great that she is taking the lead in reducing the healthcare sector's impact on our climate. And yeah, just want to say thank you so much, Amanda. I know you have a really busy schedule, but just so honored to have you on our webinar that will be also recorded, and we're also looking forward to the Q&A after your presentation. But yeah, for now, please proceed with your presentation, and just looking forward to learning so much from you.
Thank you so much, Ingshan, for that lovely introduction. I think you have been overly flattering of me. I am just a mother of two, happen to be a pediatrician, and I think also happened to actually wade into this space. I started to kind of wade into it when I was about to actually have my first kid, and just wondering the kind of world that I would be handing down to my children. So I must say, first of all, as a disclaimer, I am by no means an expert in this topic. I think I'm also a learner as well, and I have been really excited by some of the work that's come out of this space. And I thought that I would just try and synthesize what I've learned in the last few years and try to present it to you in a way that will hopefully have more questions coming. I hope to basically have you ask more questions rather than for me to address your answers in full, because honestly, I think that there's a high chance that I may not be able to, but I'll do my best. So yeah, let's go into it. I think today I'm talking a bit about climate change and the relationship with our children's health. I will be having a quick overview of what is planetary health, which I think is, a buzzword that you may have come across, and how planetary health affects human health. What are some of the organ-specific impacts of climate change on children that we do know about, and as parents, what we can do as a result of all this information. So I think, first of all, as an introduction in terms of what planetary health is, I think planetary health is basically a way of thinking about our health and the planet. And essentially, this donut model here represents that model. Climate change is basically just one of the planetary boundaries, but there are several other planetary boundaries that exist. And essentially, as a society, as a human race, we depend on these planetary boundaries to have our lives, our economy, our social networks. And there are boundaries beyond which, if we infringe it, that basically we run the risk of tipping this balance. And that can actually come back and impact us in many ways, right? And these are both in direct as well as indirect ways. In another diagram, this is a diagram by a friend that I met at COP last year. Her name is Courtney from Canada, who basically has shown that basically there are these things, concepts of ecological determinants of health. In medicine, we have a concept of social determinants of health, and there are many other structural determinants of health as well. But really underpinning all that are the ecological determinants of health, whether it's the presence of extreme weather, biodiversity, soil loss, water shortage, global temperature rise, sea level rise, and all those affect many of our key systems of how we function as a society, whether it's our livelihood, whether it's our education, our transport, our government, our housing, and that in turn impacts our health systems. And the health systems are affected through, again, both direct and indirect ways, either to our patients, caused by heat stress, for example, poor air quality, and even our workforce, which are entirely essential in running that health system. And then there is the access to health system as well that can be damaged or disrupted due to disruptions in our ecological determinants of health. I will go on a little bit to talk about some of the actual health impacts that we are at risk of or already starting to face. And I think the Lancet has put it quite well that climate change threatens to undo 50 years of public health gains. And I think that is really sobering for us, especially as health professionals, that we really need to think beyond, our here and now, beyond the next patient that we see, to really think about the health of the entire society, not just today, but also for the future. And in turn, that really means our own children. So I mentioned quite briefly earlier on about the direct as well as indirect pathways. And this can actually happen through various types of weather events, right? So it's not just that it's getting hotter, but it's also getting wetter. And that cycle actually sets up a vicious cycle where we have more droughts and heat waves and floods and typhoons and storms concurrently. And then there are indirect pathways as well, either through our natural systems or social institutions, where basically we risk having much bigger impacts on our well-being and our health. And for children especially, I think there are specific factors that, make children a little bit more susceptible than adults. So one of which would be the fact that, especially if we're talking about fetuses in utero, they would be completely reliant on, the placental blood supply. Their organs are very sensitive to all these environmental exposures, and they're all still in the midst of organogenesis, or the organs are still developing. They also have poorer thermoregulation under extreme heat conditions, and we also see that children may have certain conditions that may impair their ability to adapt. Like we know that with gastroenteritis, for example, children are more prone to getting dehydrated just because they have, they're smaller. And at the same time, because we are seeing climate change already happen today, so the exposure that they receive, poor air quality and all that, the cumulative exposure over the course of their entire lifetime is actually much more. Children in general spend more time outdoors, so things like air quality and all that are going to impact them more. They are less likely, I think, than us to comply with sunblock, right? So, likewise, them being able to kind of thermoregulate and actually know what to do in situations of extreme heat are impaired compared to us. And they also have a higher metabolism. And as I think Yingshan had mentioned, I think it's just really staggering that children under 5 bear almost 90% of the burden of disease due to climate change. And of course, this is unequally distributed. The poor will be disproportionately affected, and they already do, as we can see from the numerous extreme weather events that have happened in the last few years. One of the, I guess, most pressing things that we are dealing with in Singapore is heat-related illness. I think there is almost a sense of apathy about it, because I think everybody thinks that we are used to the heat in Singapore. We all know that Singapore has been hot and humid for the longest time. But I think the reality is that heat-related illness is still very much relevant, right? So at least worldwide, heat-related illness is still increasing, of which children form half of this population. And we know that we still see heat-related illness in Singapore. This is still relevant. We see about 70 to 120 hospital admissions for heat-related illness in Singapore. This is not just for children, but including for adults as well. And this, unless there are specific interventions in place, we are going to see things get worse. What happens in children? I think that today children will grow up with many more days of heat than we ever will. For example, I think data from the Lancet Countdown in 2022 tells us that infants experienced 600 infants born in the period of 2012 to 2021 experienced about 600 million more person days of heat waves than those born between 1986 and 2005. And we see that that heat-related illness, there were increased emergency visits for any cause, especially like dehydration, bacterial enteritis, otitis media, were higher when the temperatures were higher. There were increased visits for electrolyte imbalances when temperatures were higher, increased hospital admissions when temperatures were higher, and increased kidney damage in the pediatric age group between 5 to 14 years of age when temperatures were higher. And in fact, heat waves do kill infants more than the rest of the other populations. And that's been proven in numerous studies. And we can see, I think this was the latest climate study that came out just earlier this year from the government, that basically by the end of the century, nearly every single day of the year in Singapore will be very hot, and we will experience high heat stress. So these are quite sobering figures. In terms of what we can do to protect against heat-related illness in children, I think that there is a fair bit of work now looking into this. We have a heat stress advisory for the general population, for those who are being exposed to prolonged outdoor activities. This hasn't quite been adapted for children yet, but we do know that, the schools, preschools are all taking note of this, trying to see if they can modify their uniforms, their outdoor activities in relation to their exposure to high heat. So as I mentioned, I think children thermoregulate differently, and they take longer to acclimatize to warmer environments, and they have less of that developmental ability to kind of adapt and have that behavioral adaptation to very hot temperatures. And there are certain conditions that would impair the ability to thermoregulate, and we are seeing an increasing incidence of obesity and diabetes among our children. And so this is something that we do need to take to pay close attention to. The next thing, apart from heat-related illness, I think would be infectious diseases. So I think infectious diseases actually would be kind of the signature, type of condition that is extremely climate sensitive. And there are many factors that drive this. There are lots of different climate variables, and there's been many studies looking at various infections that have shown how climate sensitive many infections are. I think the one that is most pertinent to us and also most well studied are what you call the vector-borne diseases, the ones that are being carried by mosquitoes and ticks. And I will briefly go through them here. So I think what the research has shown is that mosquitoes and tick-borne diseases show an increased sensitivity to various climate variables. And the projections for the coming years, as we see more climate change, if it's left unabated, is that there will be an expanded geographical range. So more of the northern and southern latitudes will start to see dengue where we previously had not seen before, malaria as well. And with the mosquitoes, we will see that the mosquitoes actually have an increased capacity and longer transmission seasons to actually transmit the disease. Interestingly, I think the data for malaria shows that actually in Asia, there is going to be some decline in some places, an increase in some other places like China and Taiwan. I think it's in Southeast Asia, we should actually see a decline in malaria. But for dengue, Zika, and chikungunya, we've seen some of the research come out that the overall transmissibility actually will go up by about 12%, or rather has already gone up by 12% each due to climate change. There is another entity called Japanese encephalitis. It's not here, but in places like China, for example, they've had good vaccination outcomes where they've seen a reduction in childhood cases. But now adult cases have started popping up, and they think that it might be related to climate change. There's also a geographical expansion of Japanese encephalitis in places like Tibet, where it was previously a Japanese encephalitis-free region. So I think these are important implications for parents, especially when you're traveling out of the region, that you do need to take note of what is the latest in terms of prevalent diseases, emerging diseases, and get the necessary vaccinations if it's possible. We are also seeing a higher incidence of Lyme disease, and not locally but globally, and that's expected to continue to increase by about 20% mid-century because of climate change. The next thing that I think is particularly climate sensitive are actually food and waterborne diseases. We're expecting additional 48,000 deaths from diarrheal diseases in children under the age of 15 by 2030, and that's data coming out from WHO. A third of that will be predicted to occur in Asia, especially in South Asia, and that's even after considering improvements in child health. And a lot of that is actually driven by water scarcity, food insecurity as well. That may be relatively remote for a place like in Singapore, but I think still relevant to know that that these climatic variables are these changes are already actually taking place in Singapore, and I'm not surprised that we will start to see shifts in our epidemiology in terms of the types of diseases we see walk into our clinic with these fluctuations. What are the causes? I think I won't go into detail about which bug causes what, but we've seen evidence for an expansion in something called Vibrio, Salmonella. This is mainly because with the warming waters around in the oceans, we see an extension in the seasons of bacterial growth. We also see there's a lot more warmer coastal waters, and at the same time we are seeing a growing coastal population among our cities. And I think the evidence for that is that we've actually seen outbreaks of these kind of diarrheal diseases following heat waves. I think there's still a fair bit of research that is lacking in some of the other common bugs that cause gastroenteritis or diarrheal diseases. And so I think it remains to be seen. I believe there should be more literature coming out in the coming years on other bugs like Clostridium, Shigella, Campylobacter, E. coli. What I think is actually particularly pertinent to Singapore is actually hand-foot-mouth disease, and numbers are actually increasing all over Asia, and not just in Asia, even in the US, in Europe, they are seeing increasing numbers, particularly in the summer months now, with lots of children having hand-foot-mouth. There are known summer outbreaks in temperate countries, and I think the emerging evidence is that climate change will likely exacerbate the incidence of hand-foot-mouth as well. Respiratory viral infections, I think this is a question mark here because I think it's unclear exactly what the trend will be, but it seems like climate change will interact with other factors that are adjacent to climate change, like air pollution, ground ozone concentration, and the pathways are fairly complex. I think the jury is out as to which direction these respiratory viral infections will go as the climate warms. We do have a lot of short-term weather variable data on how some of these viruses are impacted by various climate variables. But I think it's not clear, whether we're more susceptible to, say, for example, influenza or RSV just because of climate change. Allergies. So allergies, I think, is a huge burden for us in Singapore. Many of our children have asthma, allergic rhinitis, eczema, or food allergies. And I think this is where there's a rich, fertile ground for further research. What is expected is that with climate change, we are going to see increased allergens from pollen, from wildfires, dust mites as well as ground level ozone. So what we do know is that with that pollen is driven by an increase in temperature as well as the carbon dioxide concentrations, and we know that's been going up. We are also anticipating to see increased pollen seasons and allergen exposure. And I think there's some evidence that the pollen will interact with PM2.5 to increase their allergenicity, meaning that a person is more likely to become allergic to pollen than if there wasn't that increased PM2.5 or the increased air pollution. With dust mites, temperature, so warm temperatures, humidity, those things actually promote dust mite survival and proliferation. And I think there is concern that this will increase the amount of dust mite allergy that we see, but I think we haven't quite proven that in the literature yet. And then there is also this entity of storm-associated asthma exacerbations, whereby it even killed a few children in Australia, where there was a huge, during a major thunderstorm, which we see more of in the event of, in the face of climate change. There's a huge release of pollen, and that has actually killed some people in Australia. With climate change, we also expect more air pollution that come hand in hand, although they're slightly sort of like adjacent, issues. But essentially, what we do see is that that's driven by two things. So one is droughts, and the other is ground level ozone. So essentially, I think when you have a hotter world, we will have more droughts, and with that increases the risk of wildfire, and that wildfire actually drives air pollution. And the emerging evidence is that wildfire air pollution is actually more toxic than the other types of air pollution. The particles are actually smaller, they travel further, and they actually persist for longer in the environment. And we have seen multiple cases in the past year where emergency departments have seen more asthma-related visits to the emergency, more asthma-related hospitalizations as well as a result of wildfires. And I think for Singapore, that the risk of regional transboundary haze, I think this is still very much a relevant problem for us, I think, as we face on and off bouts of acute haze. With ground level ozone, I think basically what happens is that there are these noxious chemicals which will interact with a higher temperature to actually increase the amount of air pollution at the level that we are at. So even though ozone is, considered protective at a higher layer in around the Earth, but at our level, at ground level, ozone is bad. And what we do see is that with increased ground level ozone, there is an associated increased risk of various types of infections like influenza, rhinovirus, RSV, even COVID has been proven to be associated with that. Short-term air pollution is also associated with more visits to the emergency because of asthma, and we do see that that's more pronounced in children. Traffic-related air pollution has also been associated with diagnosis of asthma, ENT infections within the first few years of life. Climate change also threatens our food security, our children's quality of nutrition. And I think although at first glance, most of us may think, well, Singapore is a fairly secure country in that sense, like, we can afford an increase in prices. But really, I think that food security is extremely existential for us, which is why the country is moving towards an increased level of food security, right? What we have seen in the literature is that with climate change, we're seeing poorer crop yields. There will be increased temperatures to drive, or rather to shorten the crop growth seasons globally. And it's not just in the agriculture, it's also in the ocean. So we know that the oceans are warming and having acidification, and that actually affects our marine and fishery productivities. There is a pretty interesting study that came out of the US where they showed that a high carbon dioxide concentration reduced the content of nutrients like zinc, iron, and protein in some crops. And that means that we really do get poorer quality food from even if the food is there, right? And finally, I think we are also at risk of those extreme weather events. That is, we're going to see that heat wave days are going to be associated with more food insecurity in the coming years as we face more and more impacts of climate change. So this is also still fairly nascent field of research. Increased heat from climate change, worsening air quality adjacent to climate change is possibly affecting pregnancy as well as our growing fetuses. So with heat, for example, it's associated, and extreme heat is associated with preterm birth, and also a higher incidence of spontaneous abortions, especially somehow in male rather than female fetuses after heat exposure. And there seems to be an increased odds of, having a smaller size baby with like low birth weight. Air quality also seems to be associated, like worsening air quality also seems to be associated with preterm birth and intrauterine growth retardation, and as we mentioned earlier on, low birth weight as well. And I think beyond just the pregnancy, I think neurodevelopment or the fetal brain development can also be affected by the impacts of climate change. So there was an Italian study that kind of correlated that the amount of nitrogen dioxide exposure, which is one of the pollutants at birth, was associated with a reduction in verbal IQ points by 1 to 2 points. And the evidence is small, but I think we do need a lot more research in this space. And and finally, I think climate change also has a major impact on mental health, and children are not spared from this. There are obvious concerns about, if there's natural disasters, there's a need for climate migration, or if there's climate displacement, there are obvious risks of things like PTSD, post-traumatic stress disorder, grief, from having to be displaced from your home. And it can also exacerbate or make the existing mental health problems that children may have worse because of a lack of access. They may be further psychologically stressed. And the other interesting thing that has come out of some of the research in climate change and health is this concept of heat aggression psychology. Basically, what we have seen in adults is that with higher temperatures, there are higher rates of homicides, aggression, and there are even higher rates of suicides. And I think how that has translated to some of the evidence in children, there is actually a study that has shown that that the higher suicide rates have been reported. There appears to be a higher odds of injury among children, whether or not it's unintentional or intentional, that present to the emergency department. And with that acute rise in temperature, there also seems to be more mental health related encounters in the emergency department among children as well as adolescents. And we think that it is, we don't really know why this is happening. We think that there may be more for example, either an impairment in the sleep quality, the control on your behavior, being able to regulate your own behavior that's impaired in times of heat stress. And I feel like that is something that is plausible, given that usually when we ourselves feel extremely hot, right, we tend to be we tend to actually take more risk-taking behaviors, actually. And I think that there is some increasing evidence around that. And finally, I think there is this concept of climate and anxiety, or eco-anxiety, and that is a very, I would say, quite a trending topic in this day and age, where more and more youths are reporting that sense of anxiety, anger, grief, and hopelessness as some of the emotions that they report in in the face of worsening climate change, and especially when it feels like as if the world is not acting fast enough and bringing down our emissions fast enough. And there was a survey of youths in the US and the UK and I think Australia, where they actually showed that there were a majority of youths endorsed that feeling of disempowerment in relation to climate change. So I think that's concerning, and I think as a parent, that is of course worrisome to me. I think even I myself face a little bit of that eco-anxiety, and I think moving forwards, we will probably see more of that. And so what is that buffer, I think, against eco-anxiety is really, I would say, climate action, being able to do something about it, to feel like there is something that is within your control. There is a concept of climate and health co-benefits, where basically as a physician, I would then encourage behaviors that not only benefit the climate, but also benefit myself. Some of those options are, really not rocket science, really. I think it's like encouraging plant-rich diets, encouraging low-carbon transport, taking the bus instead of driving. And some of the other more specific interventions, maybe things like, for example, switching to electric cook stoves to reduce indoor air pollution. And I think all those will somehow indirectly help us to reduce our carbon footprint and contribute to that transition to net zero. So I think the take-home message that I would like to send is that climate change is just one of the many planetary boundaries that we are infringing upon, but that I would say that climate change is arguably the most important. The ecological determinants of health, I think, are the foundations upon which all our other determinants of health rest. And almost everybody's body system can be impacted by climate change through various pathways, right? And the magnitude to which they are impacted are really variable. And I think in many ways it's hard to say exactly what the degree is. We need a lot more research, and with time, but
Hi, Amanda.
hello.
Hi.
Did I lose?
Thank you for.
Did
Yeah.
I hope the
Something
connection
happened.
was okay.
I think it was just the last 2 minutes of your presentation, so you kind of froze a bit.
Oh,
Yeah.
okay.
Maybe do you want to just sort of like recap?
Was it the take-home messages that you might have missed?
Yeah. The
Yeah.
second last slide. Yeah. No worries about
Yeah.
it.
No worries. I mean, all I wanted to say was that I think climate change is probably, I think, one of the most important planetary boundaries that I think we are infringing upon. That the ecological determinants of health are really the foundations upon all the other determinants of health rest. That almost every body system can be impacted by climate change, and to be honest, some of them we don't really know the real answer of how much. But there is definitely enough evidence to say, for example, with vector-borne diseases, it's quite clear that it's extremely climate sensitive, and we need a lot more research into understanding it better. But at the same time, that really shouldn't delay us from, engaging in climate action, because that's ultimately what we need.
Totally, that's so true. I think you presented a lot of very sobering facts that made us feel like, oh my gosh, the world is going to end. For especially,
The world
I
is
mean,
dying, and so are we.
prospects are really not good for our children. I was just wondering, what is the healthcare sector doing, in anticipation of all these health impacts, knowing that you would have more vector-borne diseases, etc., with increasing temperatures? What is the healthcare sector doing to prepare itself?
I mean, I think locally we are very fortunate, right? Usually the government is extremely prepared about these things. You would have seen, I think, in my previous earlier slides, that there's already things about like heat stress, for example. You would have seen in the news as well. There's a lot of attention on heat stress and resilience nowadays, and there's a heat stress advisory, for example. So I think that there is a lot of attention on heat, and I think, even with things that may seem a little remote from climate change, but even healthier SG, or a shift overall to preventive health and well-being, those are important because, for example, your aerobic fitness would absolutely affect your ability to adapt to the heat, right? So having children who do not have diabetes, who do not have obesity, who are aerobically fit, those things are actually going to be helpful for our children in a warming climate. Beyond heat, I think with vector-borne diseases, there's always been a lot of resources being poured by NEA into preventing or reducing dengue transmission. You would have seen in the news that recently dengue has again gone up. We've been seeing lots of rain, and I think that I do have confidence that our health system will continue to adapt best as we can to that. But how much really can we adapt our way out of it beyond just staying indoors in our air-conditioned bubble? Ultimately, I think we want our children to lead full and active lives, outdoors, right? So there is going to be a need for us to also take personal responsibility, I think, as parents, to be to have our children as healthy as possible. Really, I think that is honestly in a dying planet, like, it's really survival of the fittest, right? So we do need to do everything that we can to help our children be as healthy as possible. But of course, I think that there are things that I would like our health system to do better on, and which is why I am involved in that space, which is to really look at our own healthcare emissions and to try and drive that down. Because it cannot be that as a healthcare professional, for example, right, as a doctor, I am driving inadvertently in my professional capacity, I am driving emissions that cause climate change, that is in turn actually making my patients sicker. So I think that is an ethical imperative that we need to respond to as a system. And so I do hope that we will do that in a bigger way moving forwards. I think there are several health systems around the world that are already starting to do this, but maybe not quite enough yet. We are actually decades behind, I think, most other sectors in terms of decarbonizing our industry. And then I think there is also something to be said about outside of Singapore, right? Singapore is very fortunate to be in a financially good position that we can potentially adapt our way out of this thing to some degree, but not to the full degree. I mean, with rising sea levels and whatnot, that there's just so much that we can do. But what less for a lot of the developing countries in the region? I think that there are many health systems that are ill prepared, and that's where I do hope that there will be better planned adaptation responses. And I think that we are slowly waking up to that idea, although again not quite as quickly as we hope to. This past COP28 at the UN Climate Change Conference, I think we saw for the first time that there was actually a health day dedicated to looking at the intersection of climate and health. So, yeah.
Amanda, I really love your sense of empathy and justice, and what you mentioned about in your slides about the increased sort of observations of heat aggression psychology reminded me of one parent whom I spoke to previously. He is a social worker, and he was sharing with me how he noticed that in rental flats, really they are bearing the brunt of rental flats in Singapore, they are bearing the brunt of warmer temperatures because they don't have aircon. Yeah, and I think that is something that within Singapore also we need to consider. Yeah. So I have a couple more questions, but let's go to the question from Singing. What do you think would help more physicians feel that sharing or working on climate action is within their locus of control?
That is an interesting question. I think that I think physicians are generally. I think generally, I think society has a high level of trust in physicians. I think that at the same time, physicians are also quite bogged down by multiple things. Making sure that they're doing their best for their patients. There is also, a sense of having to, I would say, give patients what they want, almost like in a way that, like sort of like in a customer service kind of way, where you kind of need to make sure that you are pleasing the patient and the parent. And I think generally at least for pediatricians, right? Many parents come in asking for a maximalist style of care, right? Where they will say, I want you to do everything that you can possibly do under the sun, to make sure that my child is well. And I identify with that feeling, right? I mean, as a parent, you absolutely want the best for your child. I just don't think that, and this is, I think, something that most, if not all, pediatricians would agree with me, that more doesn't mean better. Like, for example, a very frequent conversation that I have with parents is like, for example, cough medicines. Some children get like, one medicine per symptom. And I think in a very, very busy clinic, we kind of just, the tendency would be to just give in to that sometimes, rather than to take that extra few minutes to explain why that's not necessarily the best thing forwards. How does this relate to climate change? I think, number one of the things that drives, I think, healthcare admissions up is in our prescribing behaviors. The more, we overdo or over-investigate or over-treat, actually that is one of the drivers of our unnecessary emissions. We're not carbon efficient in the way that we practice. And of course, like where it's necessary, if your child needs antibiotics, like as a doctor, of course I would prescribe that, even though that does have a carbon cost attached to it. And I feel that this is where, the demand from parents is actually really important. I think that if parents could, number one, I think have a slightly different approach to healthcare, in terms of consuming healthcare, that would help. The other thing also is that obviously if I'm someone like me, climate conscious, and I want to kind of expound this in the clinic room, I would be fairly cognizant of the fact that, maybe there's a lot of apathy among Singaporeans. There was a Southeast Asian survey that showed that that half of Singaporeans really did not think that climate change was important. And so therefore, if I mention something like that in my clinic, they might look at me like as if I'm really weird. So being able to, I think as parents, reflect that, this matters to us, that climate change is something that we care about and we seriously want to do something about it, I think that would help kickstart that conversation. But of course, at the end of the day, I think that these conversations probably take place outside of the consult room when you are dealing with a sick child, because ultimately, taking care of your child and their well-being comes first. Yeah. I don't know if that really answered your question, Singing. Yeah.
And I mean, as you mentioned, a lot of the conversations or a lot of the things that we can do happens outside of the consultation room, and this would be at home or in school. And you also talked about how children thermoregulate differently and how obesity and diabetes affects the adolescents' ability to thermoregulate. So, I mean, as a parent who is trying to control my son's sugar intake, I'm just wondering, can you elaborate more about like how obesity and diabetes affects children's ability to thermoregulate, so that I can explain to the grandparents or something like that?
I am not sure if I will have the capacity to explain that offhand, but I can go and check it out. I can't remember exactly how, but I do know that there's been some studies that support that, but I can check it out and get back to you.
No problem. Thank you. But it's something that I will bear in mind when trying to control his sugar intake. I'm also trying not to be too controlling. I also there's a question from Steve. Also asking, are there any studies that have looked at the effects of climate change and mental health issues on physical health? And conversely, how improved psychological support can mitigate the physical risks?
I don't know. I mean, this is it's very much an emerging space. And in fact, I know that that nationally they are interested, they are actually interested in looking at this concept of how climate change impacts mental health. I don't know if we've even gone that extra step further on how that impacts physical health. I don't know. How can improved psychological support mitigate the physical risks? I don't think that the research is as far as I know, I don't know.
Yeah. There's a question
I'm curious too. Yeah. I'm curious too. I think I suppose, like I said, I think the fact that now there is a health day at COP, the health and climate change community is sort of really trying to organize itself. At least from my observation, I think that there will be more talk about this. The health day at COP, or rather, it kind of had a spotlight on the health declaration, whereby I think about 130 or 140 countries actually signed an endorsement to say that that health and climate is important, and that we need to think about health adaptation plans as part of our climate change agenda. And so I think that's encouraging. But really, I think the devil is in the details, how exactly that translates to health policies on the ground. Obviously, how that looks like for Singapore, for example, will look very different from, say some of the other countries in the region. So and I think that there is a big question about funding. I think there has been, at least at this last COP, there's now funding going into this space. How that will be, I suppose, dispersed is something that I have no clue of.
Yeah. I mean, there's a question from Julia. How do we educate parents about healthcare versus sick care? Yeah. Why is the tendency to opt for maxi meds?
Yeah, I mean, this is it goes back to it's a much bigger public health question, and I think it speaks to differences in how our health system operates compared to many other countries. I mean, you will see that, say for example, in Europe, if you have a fever, if your child has a fever, even 39, 40 degrees, you you take Tylenol, right, or the equivalent of a paracetamol, and you rest at home. You don't really see the doctor until you're about 4 or 5 days into illness. And I think that comes with a level of confidence. I think at least in children, I think fever is something that causes a lot of fear among parents. There is always this misconception about fever causing brain damage, right? And that is something that even for myself, my colleagues, when we see patients, it's something that we actively constantly try to educate parents on. But I think we do have a long way to go in terms of public education on that. As for healthcare versus sick care, yeah, I think this is exactly what Healthier SG is trying to propagate, and I think that is the correct thing to do.
About healthcare and about raising healthier kids and eco-anxiety, because we had a webinar previously on managing eco-anxiety, and I think the message is has always been like go to nature, and spending more time outdoors also promotes healthier bodies.
Yeah.
So I was just thinking about, in Singapore, our urbanized setting, we have a lot of air conditioning, and with increasingly warmer weather also, for example, you feel very hot outside and then suddenly you go into the bus that is air conditioned. Just wonder whether you have any thoughts about that. The other observation I had also is about how related to air pollution is that for some reason the height of our kids is also the height at which they can or rather the height of vehicular exhaust pipes is also kind of where, because our kids are so short, they would kind of inhale the vehicular exhaust more easily compared to us tall adults. So just wondering whether you have any thoughts on these.
Yeah, I mean, overall, our air quality is, well, although, there's a study that says like something like 99% of our cities, with us included, live in unsafe levels of air pollution. But I would say that compared to rest of Asia, I think we're not so bad. I think generally we have pretty okay levels of air quality, pretty good actually. But definitely I mean, there are places that have better air quality. There's an interesting study that was done locally that showed that children who went to better schools, basically those that had to travel out of their, if you say within 1 or 2 click, or 1 click, right, you walk to school, right? And so how like some of those more popular schools, and you would kind of like travel wherever just to get there. Those children, they measured the amount of exposure to air pollution in those children who traveled more for their school commute, and they found that the exposure to air pollution is actually higher. So yeah, I mean, what's the implication of that? I don't know, but I think it spoke to me because, well, I mean, I have a son who's enrolling in primary 1 next year, and that proximity to school, always weighs heavily on us as parents. But I think, yeah, as much as possible, I mean, what can we do, right? I don't know. I think, yeah, I don't really have I don't really have a strong comment on that actually. I mean, it's just sort of interesting to know.
I know in the US there was a movement to electrify school buses, and one of the reasons cited, I mean, besides the carbon emissions from fossil fuels, is that like, because of when school buses are idle, they would still continue to emit exhaust, right? And this exhaust kind of seeps into the school bus, carbon monoxide and stuff like that, and so the children would breathe it in. So that was one of the reasons for a movement to electrify school buses in the US. Okay, there's a question from from Singing. Is there sufficient literature around health impacts for children or more generally from Asia or tropical areas, given the impacts and shifts seem to be across different geographical regions? So whether it's from Asia or tropical regions,
Yeah, absolutely. I think there's not sufficient literature, which is why I mean the presentation is fairly vague, and even the numbers that I can quote, it's few and far between. I think there's generally insufficient literature. I think that it's only in recent years where climate modeling, I think, has become sophisticated enough for us to be able to have more geographically specific studies. Data has always it's really I mean I'm not a climate scientist, I'm not a public health scientist, for example, but what I do know on the topic is that a lot of it has to do with the strength of our data inputs, as well as the kind of models that we're using, and those have only seen significant improvements in recent years, for one. And I think you're right in terms of research coming out of Asia. I think generally a lot of the research has actually come out from the global north or the west, basically. And so for sure, I think Asia gets a little bit less attention. And that's a known, I think, limitation. But especially for vector-borne diseases, I think, and dengue, for example, I think there is actually a fair bit of really good quality research that's also coming out. And I think even, for example, our colleagues at the School of Public Health are actually actively looking into this.
Yeah, but as you mentioned also, the gap in research shouldn't be a reason for us to what do you call that, to take our time on climate action, because we really need to take climate action now.
Yeah, absolutely. I think honestly, whenever I prepare for a talk or write something just on the climate impacts on health, I always feel slightly depressed and slightly disempowered, because I think what's actually really more important is about what we can do, right? So if you don't tie these sorts of conversations to action, that can actually, I think, increase the level of eco-anxiety. So I think it's really important to still come back to what we can do.
Totally. But you also think that these sobering statistics would be a reason for the politicians at the COP that has taken place for almost a generation to take action, but they're still talking. But yeah, definitely what we can do at an individual level will help address our own anxieties too.
I think it's not just our own individual actions, but I think it's also like we spend a lot of time for those of us who are actually who are working, our professional spaces, right? Because that's when you have whole industries, we have whole sectors, whole organizations actually having substantial emissions. And I think those are the ones where if we can influence those things, those count more than your own family reducing one family's emissions. Of course, that's important, but I think importantly, we need to think about how to break out into the more professional space.
Yes. And I totally love your initiative, your sense of empathy, your passion, and your sense of justice, and the sort of the drive to bring it into your professional space also, because I think some of us, when we're talking, with my friends who are also parents, they may feel that things are happening, but what can they do at the household level? But then sometimes in their professional space, they also have the capacity to make change and make whatever they're doing professionally more sustainable as an industry. So we definitely have to look into every aspect of our lives to see where are the sort of spaces for us to do climate action, because we are involved in so many activities, whether at home or whether professionally, and these are all opportunities for us for climate action. Yes. So we have come to the end of the hour, and I know you have 2 young kids whom you have to put to bed. So thank you very much for spending your evening with us. I really appreciate your time and your sharing your expertise and sharing your reflections as a pediatrician and also as a mother. I feel that what you have shared actually is really sort of the building blocks, the statistics, the building blocks for what we have also discussed in previous webinars about eco-anxiety, about bringing our kids outdoors despite the climate crisis. And so, like, even though this is the final webinar, but because all the webinars will be on YouTube, I hope that viewers will also like kind of watch yours first, and then after that refer to the other webinars. Yeah. So
Thank you so much for having me. I mean, I'm just actually really honored to have been invited to come and speak here. And I will go and check those other webinars out. And I really wish you guys all the best. I think this is really great, I think, for parents.
no, thank you so much, and have a great evening to you and to our audience also.
Thank you.